Hey there everybody, welcome to SRT Therapy, also known as soft stretch release techniques. So what sets SRT aside from the other traditional forms of stretching and non-traditional forms, right? We have more of a fascial stretch based approach as the market has started to trend towards stretch therapy. But really what sets soft stretch release techniques aside is that it's just that. It's soft stretch release techniques. So there's not a specific methodology, there's not a specific system, there's a combination of techniques that are focused primarily to address the nervous system. So the biggest difference between PNF stretching, fascial stretching, active isolated stretching, reciprocal stretching is the fact that a lot of these stretching methodologies and sequences are working with your muscular and your fascial system. They're working from the mechanical standpoint of muscles and fascia. Our primary approach with SRT is nervous system primary. First and foremost, it is your nervous system. If there is any stored trauma, emotionally, energetically, mentally, or physically, that is in the system, your nervous system is going to be the barrier to entry. So while sometimes aggressive stretching feels good or aggressive deep tissue work feels good, the biggest thing to remember is that whether it's skeletal, it's going to be muscular. Whether it's muscular, it's going to be nervous system. Whether it's fascial, it's still going to involve nervous system. Your nervous system is innervated in between your fascia and your muscles. And so if the nervous system is controlling the muscular system, and your muscles are pulling on the bones, and your nerves are innervated with fascia, and the fascia is overlaying the muscle and also pulling on the bones, at the end of the day, the primary system comes back to our nervous system. So with soft stretch release techniques, the focus is nervous system first, fascial system, and lymphatic system. So because of our soft applications and the slow approach to creating support for the body, whether it's the leg, the arm, the trunk, we're creating safety within that nervous system. So if there is trauma, and if there are stuck pieces of fear, anxiety, stress, sadness, any lack of touch, lack of love, lack of acceptance, what we're doing as the professional, as an SRT professional or an SRT specialist, is understanding that in order to work with the muscles, the fascia, and the immune systems, we need to work with the nervous system, lymphatic system, and also the fascial system as we unwind and release restrictions, adhesions, and fascial issues that might be occurring within the whole system. So, to better understand SRT, you have to understand that we are not focused on stretch therapy as is being rolled out in the public. So we are focused on nervous system downregulation. We are focused on safety and security with the client's system. In order to achieve better range of motion, in order to achieve longer holds in the new patterning that we're creating by installing this new data, we have to understand that working with your nervous system is going to be utmost important versus working against your nervous system. So, the difference between SRT therapy, soft stretch release techniques, and the other forms of stretching therapy that are currently on the market is the systems and the philosophy that we are working with, okay? While other stretch therapy is working with muscular and fascia, we are working with nervous system, fascial system, lymphatic system. Through those three systems, we can address the muscular system. We can release tension at the joints as we've unlocked the fascia, and we're improving not only nervous system downregulation, but we're improving because of the lymphatic movement and the soft touch that directly and indirectly affects the lymphatic system. We are improving blood flow, lymphatic flow through your circulatory system. Also improving your immune system. So there's a plethora of effects that SRT therapy is going to offer outside the spectrum of what we traditionally think as stretch therapy. So, hope this video helps you guys understand a little bit more about the focus and the intention behind SRT therapy. You can check out any of our classes, upcoming live courses across the US, Canada, or Sweden at the website srttherapy.com. Check us out if you're interested in becoming certified as an SRT professional or moving into the SRT specialist title. We would love to meet you in a course. We also have our online academy for those of you that are not able to come to a live course but still want to learn the SRT philosophy and applications. We'll see you guys in another video.